Hi, everyone. Today I want to speak to you about heart rate variability. It is a cardiovascular measure, and I'm hearing it discussed more regularly in yoga and yoga therapy circles, in mind, body, and integrative health circles. And due to its complexity and the required physiological background knowledge, it is not always clearly understood. And there's real value in clearly understanding it. It can influence the way that you choose to practice yoga. If you're a yoga teacher, it might actually influence the way you teach your classes. And for those of you offering one-to-one sessions that are informed by yoga, it might also influence that. Additionally, understanding heart rate variability and how yoga can influence heart rate variability and being able to describe that lends credibility when speaking to the medical community about the efficacy of yoga in health conditions. Now, I'm going to go through a brief PowerPoint with you. And the reason I've done that rather than just to describe it here is I wanted to show you some nifty diagrams. And also, I wanted you to have the bullet points in a logical flow so that if you want the language to describe it, you have it and you can go back to it in a very clear format. So without further ado, let's go to the PowerPoint presentation. Okay. So, what is heart rate variability? In its most basic form, it is actually exactly what it says it is. It is a variation in heart rate. And that is a normal thing that happens all the time based on certain mechanisms that we will discuss. If we want to get a bit more technical, it is a measure of the variation in time between successive heartbeats. So how quickly you have heartbeats in succession, and usually within a standardized time frame, right? So there can be a lot or fewer. Now, if we want to get really technical, heart rate variability, as it says here, is the changing rate between RR intervals. To understand an RR interval, we need to get into a little bit more of cardiovascular science. So, how does the blood flow through the heart, right? So briefly, it enters the right atria down to the right ventricle, sorry about that, goes to the lungs, then enters the left atria down through the left ventricle where it's pumped into the aorta throughout the body. Now, if you are measuring the cardiovascular process of how the heart is working through EKG, you have these kind of ebbs and troughs. Now, the R is the point within that entire beating process right before the left ventricle pumps out blood, right before it. So an interval is the time between when the blood is just about to be pumped out and the next time it's just about to be pumped out. Now, if those happen in rapid succession, right, the heartbeat is essentially quicker. And if that happens in slower succession, then the heartbeat is slower. So, okay. Why is it so important? Well, heart rate variability is a crucial measure of the flexibility of your autonomic nervous system. The ability to move from a parasympathetic state to mobilize into a sympathetic state. And that doesn't need to be fight and flight. That can just be like the energy to do a task. Likewise, it's the capacity to move from a state of mobilization when there is no necessary stress or thing that requires high level energy into a state of calm, right? So the greater your heart rate variability, the greater that flexibility between states. And that is aligned with greater well-being overall, right? We know that low heart rate variability is associated with poor mental and physical health, right? In fact, when discussing PTSD, which is commonly discussed, or trauma within the yoga world, it might be useful to know that low heart rate variability is one of the things considered not in the diagnosis, but in research around PTSD and trauma, right? And likewise, poor cardiovascular health would be associated with lower heart rate variability. On the flip side, higher heart rate variability is associated with psychological resilience, because you can go from that state of mobilization to calm, from calm to mobilization. And so you don't stay stuck in a state. And the state that you're in can be responsive to the external needs in your environment and your internal needs. And it is also a measure of cardiovascular health. Now, heart rate variability does naturally decline with age, and you might be surprised to find out that the biggest period of drop is actually between 20 and 40. It continues to decline after that, but that's where the greatest shift is. Now, we can't prevent heart rate variability from declining at all through our lifespan, but we can definitely increase heart rate variability and reduce the progression towards decline. And we can do this through a variety of different yoga practices that are known to increase heart rate variability. So now we need to understand what is impacting heart rate variability, so that in impacting those factors, we then have the capacity to impact heart rate variability, and specifically to increase it in a period of time, but over the long haul, so that we have resting increased heart rate variability. Now, there are different mechanisms that are responsible for this variation in heart rate. We're not going to speak about all of them. We're only going to speak about one, which is the most potent and the most commonly discussed, namely the pendulation between the two aspects of the autonomic nervous system and their output to the heart. So the parasympathetic system, which reduces heart rate, and the sympathetic nervous system, which increases it, right? And that is what is leading to this variation in that heart rate. So I'm going to do a little bit of explaining, and I have quite a nice diagram that will help you to visualize this. So the vagus nerve, it comes out of a nucleus in the brainstem, right? I'm placing my hand here so you can have a sense of it. You can place your hand there too if you'd like. And out of the brainstem, the nucleus ambiguous travels through the vagus down the heart to the heart's pacemaker, or what is more technically referred to as the sinoatrial node. And here, the vagus will release a specific neurotransmitter called acetylcholine. The effect of acetylcholine on the sinoatrial node is to reduce heart rate. So let's just look at that in this diagram. So here's the nucleus ambiguous. By the way, it got that name because originally they did not know what it did, and they haven't renamed it. So this is the nucleus ambiguous. Here we have the vagus, and the vagus is traveling all the way down to the sinoatrial node of the heart and releasing acetylcholine continuously. It's in this process, slowing down the heart rate. I'm sorry that sinoatrial node is here. It's actually like closer to here. So the label isn't right. We're pretty close in terms of where the point is, but it's extremely difficult to get a perfect diagram of this. Okay, now let's go to the sympathetic. So the sympathetic nerves, they come primarily out of the thoracic spine, and they move to the heart in a horizontal fashion, as opposed to the vagus, which comes down vertically, right? And the sympathetic nerves release norepinephrine, another neurotransmitter to the heart, increasing the heart rate. So again, let's just look at that. Here, coming out of the thoracic spine, this is a sympathetic nerve going to the sinoatrial node and releasing norepinephrine, increasing the heart rate. So constantly, the vagus is slowing it down through acetylcholine. The sympathetic nerve is speeding it up through norepinephrine, okay? Now, the vagus sends information to the heart more quickly than the sympathetic nerves. And also, it has an overall greater effect. So, when we talk about increasing heart rate variability, first and foremost, we're reflecting the vagus's ability to send more information to the heart to slow it down greater. So if the heart rate without vagal output would be like 90 beats a minute, if there's the vagus sending just a little bit of acetylcholine, a slower rate, maybe it slows down to, 80. But if the vagus is sending lots of output to the heart, maybe it slows down to 50 beats, right, in this pendulated process, so 90, 50, 90, 50. And that's a really big variation. And without getting into much greater depth, the actual wavelengths coming from the vagus are of higher frequency. So that's why it can have that greater impact. The sympathetic nerves send information at a much slower frequency. Okay. Now, heart rate variability is dramatically influenced by breathing. And you don't have to be a yogi to understand this. The medical community knows this, even if they have never, ever tried yoga, a sun salutation, a warrior, and ujjayi breath. So let's come back to the nucleus ambiguus in the brainstem. So it has the capacity, right, to increase the signaling down the vagus to slow down the heart rate at varying degrees. It will always lead to some slowing, but that slowing can be greater or lesser. Now, during the process of exhalation, the nucleus ambiguus increases the rate of signaling through the vagus down to the heart so that more acetylcholine is released and the heart rate is slower. So let's go back, right? So again, during the exhalation, the nucleus ambiguus is activated more through other networks in the brain. It's sending more output down the vagus to the sinoatrial node. So every exhalation, the heartbeat slows more than it does just the underneath unconscious pendulum that's happening all the time between the sympathetic and the parasympathetic system. In contrast, during the inhalation, the nucleus accumbens reduces the level of its signaling to the heart, and therefore, we have a faster heart rate, right? Also because the sympathetic nerves are sending their acetylcholine. Now, because the vagus, once again, has a greater impact on heart rate variability, the exhalation also has a greater impact on heart rate variability, right? Now, the impact of breathing on heart rate variability is exactly as I've described, is called respiratory sinus arrhythmia. In other words, the respiratory to the sinus, the sinoatrial node, the natural and healthy arrhythmia that occurs because of the way that we breathe, right? And sometimes people conflate heart rate variability with respiratory sinus arrhythmia, thinking that the breathing changes of the heart or the impact of breathing on the heart is heart rate variability. No, the sympathetic and parasympathetic system are sending information to the heart, affecting its rate all the time. The breath has that additional impact. And again, that's called respiratory sinus arrhythmia. And this is just a little diagram to show you that if you're breathing more quickly, right, the variation is not very big. If you slow your breath rate down, it's bigger. And if you really slow it, even more. But remember that it is the exhalation that has the greater impact on heart rate variability. So now let's talk about the practical application, right? So changing the ratio of inhale to exhale has the capacity to influence heart rate variability. And obviously, we would generally want to increase it. So when we make the exhale longer, we are going to increase that variability. And within a certain time frame through which we are undertaking the practice of that elongation. In a yoga class, you may cue that formally if you're teaching breathing, but also as students are going through specific postures or all of the postures. And this can be done with gentle inhale and exhale, or with the addition of ujjayi breathing, which should still be gentle. Doing that has additional benefit, because if you have students in poses that are challenging for them, which is going to create more sympathetic drive, if they have increased also parasympathetic drive and a slowing of the heart rate, it is easier to be present within those. Also, having that parasympathetic output to the heart in an increased way whilst in a sympathetic state allows for reorganization of the crosstalk between the respiratory, nervous, and cardiovascular systems, or we say clinically a re-entrainment, so that they work in better unison, and that will support heart rate variability. You can also cue the elongation of the exhalation during relaxing poses to enhance their relaxation, including things like restorative practices. And this will allow, therefore, during these time frames for heart rate variability to increase. But we know that through consistent practice of elongating the exhalation, there is a change within nuclei in the brainstem, not just the nucleus ambiguous, that allows for the resting heart rate, or the resting heart rate variability rather, to be greater. And that has all kinds of benefits, right? So it means there's, again, that greater flexibility within the autonomic nervous system. It means that we're going to be more psychologically flexible as well, and not just moving through states of sympathetic and parasympathetic relaxed or mobilized, but a generalized flexibility within their brain. There is a correlation between higher levels of heart rate variability and improved functioning of the prefrontal cortex, which is involved in executive functioning, right? And in addition, it will also support greater cardiovascular health. So there's loads of reasons to elongate the exhalation. And then finally, of course, this is not the only method. Having good quality sleep is really important in increasing heart rate variability. And likewise, since yoga has the potential to increase sleep quality, we know that we can, as a result of doing a practice, have better sleep that increases heart rate variability, that allows us to practice in a more enhanced way that leads to better sleep. And so this is an upward positive spiral. Another thing is aerobic exercise, right? Whereas sedentariness, not moving around a lot, is definitely associated with lower heart rate variability. And then finally, there is coherent breathing. This is simply inhaling for a count of 6 and exhaling for a count of 6. So a full breath cycle is 12 seconds. If you divide 60 by 12, you get 5. So it's 5 breaths per minute with this even inhale and exhale. Now, coherent breathing operates through the input from the vagus and sympathetic nerves, but also through additional mechanisms that allow it to be the breathing technique that has the greatest capacity to increase heart rate variability. But that, to understand it, requires a whole additional set of physiological mechanisms that I'm not going to undertake to explain within this video. But if you would like me to do that, let Minded know. Like this video if you're watching it on YouTube. And yeah, I'd love to do that. I mean, this for me is super exciting, you know? I love this stuff. That is why I studied physiology. Anyway, I hope this is helpful. If you do have any questions, put it in comments, write to us, and I would love to answer them. Thank you so much for listening.